As for treatment options, your handsome physician, which is in our case your dermatologist, will spend a good time taking good history and doing physical examination. He or she will ask you about medications, including all prescriptions and over-the-counter medications used for acne or other conditions, and note the clinical responsiveness to them. He will ask you about cosmetics, sunscreens, cleaners, and moisturizers you may use. He will ask about a family history of acne, and if present, the tendency of scarring should be noted too. In female patients, a menstrual and oral contraceptive history is important in determining hormonal influences on acne. On physical examination, careful note should be taken of lesions' shape and types, including the presence of comedones, inflammatory lesions, nodules, cysts, and secondary changes such as scarring. All of these are very important to note. The patient's skin color and type can influence the chosen formulation of a topical medication. Patients with oily skin tend to prefer the more drying gels and lotions, whereas those with drier skin types may prefer creams. Patients' education about compliance, diet, hygiene, cosmetics, and some habits like picking. In many patients with acne, much of the skin damage is self-caused. Although the temptation to squeeze a fresh pustule is often overwhelming, it should be discouraged because it can produce more tissue damage, sometimes resulting in scars. Patients are advised to wash once or twice daily with soap and water to remove excess oil from the skin,
but avoid scrubbing,
because this can actually irritate the skin and cause acne to worsen. They said about acne, if you want to destroy something in this life, be it acne, a blemish, or the human soul, all you need to do is to surround it with thick walls. It will dry up inside. Elif Shafa.